Number 27. The statements are about the use of antibiotics. Which practices will increase the chance of the development of antibiotic resistance in bacteria? So let's talk about antibiotic resistance in bacteria. So some of the bacteria can develop antibiotic resistance, which means it doesn't get killed by antibiotics. So I suppose we could say they're immune to it, or better say they have resistance. So they're okay with the antibiotics that usually kill them. How do they get formed? Usually by mutation. But how does this happen? Of course, mutation can happen by all sorts of things, like usually by UV lights, like any sort of irradiations and mutagenic substances. So mutagenic substances means the substances that can cause mutations, like chemical substances. Some of the chemical substances can actually give tremendous amount of stress to the cell or organism, and it can alter the gene sequence, thereby mutating the gene sequence of the organism. So how does this happen? So let's have a look at number 1. It says using an antibiotic to prevent infection. Well, it's quite vague. It says to prevent infection. There are all sorts of infections. So infections can occur by bacteria. It can also happen by virus or viruses as well. So in a way it's quite vague. So if you just use antibiotics to prevent infection, regardless of the cause of the infection, then it can actually develop the antibiotic resistance in bacteria, because if the infection happened not by bacteria but virus, then the bacteria inside the body will be exposed to antibiotics that can be effective to them, but not enough. So some of the bacteria can survive and they can become antibiotic resistant bacteria as well. But not only it doesn't actually happen just by the exposure to antibiotics, but some of them may live and then they can divide themselves by binary fission. And then during the fission, some of them can actually become mutated. Maybe one of them can become mutated after the exposure to antibiotics. So this becomes antibiotic resistant, and this one, although this one dies, this one will live, and then they will just increase their numbers. So anyways, back to this question again. So preventing infection is quite vague, so I would say this cannot be the answer. But because if you look at number 2, it says using an antibiotic known to kill the bacteria causing an infection. Yes, antibiotics can kill bacteria. Okay. So we should only use antibiotics when the cause of the disease is identified, and if the disease is caused by the bacteria, yes, then you should use antibiotics. So, okay, this procedure of using antibiotics to kill bacteria that causes an infection is, of course, right way to go. So, I'd say this will not cause the antibiotic resistance. So number 3, using an antibiotic only when essential. Yes, this is absolutely crucial. It's absolutely right way to go. Yes, we should always use antibiotics when it's totally essential. Okay. Number 4, using an antibiotic to kill of viral infection. No, antibiotics only work on bacteria. Okay, antibiotics only work on bacteria, not virus, not on virus, never. So 4 and 1 are like big no-nos because they will increase the chance of development of antibiotic resistance in bacteria. Hence, the answer should be B, 1 and 4 only. Okay?